Do you know that cold rush you experience when you step outside in the winter air? That is one of the symptoms a person with Fabry experiences. I myself was first diagnosed with Fabry disease shortly after the birth of my son in 2011. I pretty much have been mixed diagnosed my entire life because I presented symptoms, but they were misdiagnosed as other illnesses. Did you know that there are at least 50 rare diseases which causes a defect in lysosomal function? A lysosome is part of the structure of a cell, responsible for breaking down a certain type of substance so that it can be discarded or reused by the body. When a defect exists in lysosomal function, substances accumulate within a cell. Now, Fabry disease is one of the most common of those lysosomal dysfunctions. Now, I want to just bring this into your enlightenment. In Fabry disease, a protein called alpha galactoside A is deficient. So either your body doesn't create it or the enzyme doesn't function properly. Now, due to the lack of alpha galactoside, which is a fatty substance called GB3, it builds up in your lysosomes. So, because the lysosomes are present in any tissue or cell in our bodies, complication and clinical symptoms will arise. So, you may have like any type of issues going on, like cough or cold and other things that other people may just assume is like just the flu going on. So, like for me, for instance, because I'm going to use myself as an example because I am a Fabry patient, I would, on a regular basis, yearly, throughout my lifetime, every year, come down with the flu. My mother would take me into the doctor, and they would say she has the stomach flu because I would have the GI issues, which most Fabry patients are known for having gastrointestinal issues. So I would always get diagnosed with the stomach flu every year because along with the GI issues, I had the aches and pains, the flu symptoms, but I wasn't throwing up or anything. I just had the aches and pains, could barely get out of bed. So they generally would diagnose me with the stomach flu. Now, one of the challenges that a lot of Fabry patients deal with is early diagnosis because they have what's called Fabry 1 and Fabry 2. Fabry 1 is what's considered classical Fabry. Fabry 2 is one that comes later on in life. Mostly males have early onset symptoms at 2 and 3 years old. Females generally were known to not present any symptoms. So they were considered what's called Fabry 2 patients. 60 to 80% of Fabry patients reported complaints initially classic pain. Others reported skin lesions, mobility issues, inability to sweat, physical performance issues, fatigue, lethargic, healing impairment, gastrointestinal issue, renal symptoms, healing impairment, gastro issues, as I stated prior, renal symptoms, declining renal functions, heart problems, arrhythmia, stroke, and other morbidities. And these are major morbidities that will present throughout a patient's life. Diagnosis of Fabry disease is usually done through symptoms that are being presented and through a clinical lab test or genetic testing. And that can be challenging sometimes because, as I stated before, these symptoms present themselves as other illnesses. So a lot of times patients are not diagnosed until later in life. And that's why it comes to my next point, that awareness of Fabry is vital. Data exists that up to 85% of patients who suffer are not actually diagnosed until they are into late stages of a morbidity. And most of the time, the highest one is known as end-stage renal disease. A lot of patients are not able, especially through their insurance, to get the genetic testing because most insurance won't pay for genetic screenings. It's very expensive, and Fabry is such a rare disease, is not really considered in some states or in some insurance covered. And that's why beautiful companies, which we're going to come to my next point, treatment, like Sanofi Genzyme and Amicus, help assist patients in obtaining, going through the red tape, and getting treatment, which this is considered a specialty meds. The only treatment that is available is called ERT, which is enzyme replacement transfusion, or Galafold, which is an oral medication that is offered to those patients. So summing it up is that early diagnosis is important. Paying attention to the symptoms that your body's experiencing, advocating with your primary physician to make it known that your symptoms are serious, fighting for yourself, doing the research and finding out, hey, are these just regular everyday symptoms that I'm experiencing, and being aware of your family's history, finding out if anybody else in your family has had these similar symptoms, because it's really known that the father passes these diseases down to the daughter, and the daughter passes it down to the male child. And so education is so vital and important. Thank you for your time.